Apparently, if you have a child, if you breastfeed, it lowers your risk of early natural menopause. Let's take a look at this. So pregnancy and breastfeeding prevent ovulation. So read that as it slows down the ovarian follicular pool. So breastfeeding and pregnancy slows that down, which means it slows down when you go into perimenopause, menopause, because perimenopause and menopause is ovarian insufficiency. So if you're breastfeeding, okay, so let's take a look. So in this study from JAMA from 2020, they are going to examine the association of parity in breastfeeding with risk of early menopause. This was a long-running study that they did within the Nurses' Health Study from 1989 to 2015, including premenopausal participants who were aged 25 to 42. So look at the numbers of this study. At baseline, 108,887 premenopausal women aged 25 to 42 years were included in the study. That's nice. So when they were doing the questionnaires, they looked at the research, they looked at the numbers, they looked at the models, they adjusted things. They looked at exclusive breastfeeding from 1 to 6 months, 7 to 12 months, 13 to 18 months, 19 or more months, okay? And they found that despite the significant trend for the test, the estimates were not observed to be lower as duration of exclusive breastfeeding increased. The risk of early menopause was the lowest among those reporting exclusive breastfeeding for 7 to 12 months. So if you breastfed past the 12 months, it did not help any more. So breastfeeding up to 12 months is max benefit for the mother. Also fascinating, that is max benefit, I believe, if I recall the research, for the child as well. I kind of find that interesting. Now, when they crunched the numbers differently in age-adjusted models, women who breastfed for 25 months or longer during their premenopausal years had a significantly lower risk of early menopause compared with women who breastfed for less than a month. Now remember, this is all about hormones. This is all about looking at the chemistry of women and determining the ovarian sufficiency or insufficiency to determine natural early menopause or menopause age in general. This is not to give anyone who couldn't breastfeed or who struggled to breastfeed feel bad or feel grief or any of those things. This is just looking at the numbers. I actually started looking at this when I had a lot of women on one of my previous posts who were like 35, 36 and had just gotten pregnant. And they're like, oh my gosh, does this mean I'm not going to go through menopause yet? And I was like, you know what? Let's see what the research shows. And this is how I came to this. So please, if you could not breastfeed, please don't feel bad by hearing this. That's not the goal of this. This is just looking at the research. I don't want anybody to ever feel bad if they couldn't breastfeed or if they did or whatever. This is not that. So to sum it up, this particular study, in their discussion, they come out saying, to our knowledge, this is the largest study examining the association of reproductive factors with early menopause to date. We observed a significant inverse association with parity of risk of early menopause. Among Paris women, total breastfeeding was also associated with a significantly lower risk of early menopause, independent of parity. In particular, women who breastfed exclusively for a total of 7 to 12 months during their premenopausal years experienced the lowest risk. So, breastfeeding is positive for the child. It's also positive for the mother because you are less likely to have an early natural menopause, because if your ovaries can conserve, you will go into menopause later. It makes sense, right? Menopause is ovarian insufficiency, okay? It is a deficiency of hormones. If you can hang on to those little ovary eggs and you can hang on to that longer, it makes sense that we delay perimenopause, menopause later. You're all getting there, but this is just fun facts.